Hey guys, gals, and non-binary pals, I'm your host Hannah, and this is Under the Scrubs. Episode 10, baby. We are talking about the drug that I wish I could do, ketamine. I know I could do it legally, but your girl's got bills to pay. And as I'm finding out, this shit's expensive. So from a battlefield anesthetic to a vet sedative to in-hospital use and in-the-club drug, we're discussing all things ketamine today, the good, the bad, the ugly. But before we get started with that, I'll just jump into my little timeout. And this is for the book talk girlies, okay? You better count your days. I love reading. I dabble a little in the self-help and the true crime or suspense. But my main bread and butter is literature, okay? Smut, romance, whatever you want to call it, SEX, baby. And fae and dragons and witches and all that paranormal fantasy shit, okay? It takes me out of my life, transports me to some shadow daddies in a different world, and I love it. Who wouldn't? I'm on the book side of TikTok, and that's where, the other creators, they talk about books and try to advertise them or share them. And I'm so tired of hearing different people suggest a book and they'll tell you, oh my gosh, this is the best book of the year. They'll try and compare it to really popular books right now, right? And so for me, I think, wow, that sounds great. I'll download it. Okay. And you start reading this and you're like, wow, this is trash. I absolutely hate this. If you have Goodreads, I'm on there. If you don't know what that is, think of it as a Facebook for book readers. All right. You can connect with friends. You can build a virtual to be read shelf so you can keep track. You can set a goal for the year, write reviews, give ratings. It's pretty cool. I feel like I write some good reviews. So I figured I would share some of them with you. The books that were suggested to me that were just ended up being trash. Okay. Anna Huang writes King of Wrath, King of Sins, whatever the heck it is. Okay. I don't like it. My review was 2 stars and oh no, the consequences of my actions. Who could have predicted this? Literally anyone. Helen Keller could have. Okay. Not bad. Right. So then okay, here's Iron Flame, the Empyrean book number 2 from Rebecca Yarros. Look, not to be dramatic or anything, but I would slam my tit in a car door for 2 hours just to read this series again for the first time. 5 stars. There's an author, I don't even care if I get her name wrong or right, Melissa Rorick? Don't even care, okay? She wrote a series called Lady of Darkness. I said, Lady of, can we get to the fucking point already? Tried for months to finish this, DNF, which means did not finish. And then I tried to read her other series. I don't know why, but I DNF'd that series. And I said, I should have known when it took me 3 months to read 30% of her other series. And when it took me about 3 weeks to read the first book in this series. Maybe I'm developing early onset dementia, or I like hurting my own feelings and I keep torturing myself to read a book I'm not enjoying. Writing myself a note. Dear future Hannah, give this book up. You don't like it. You aren't going to change your mind. You already tried multiple times. Stop downloading her books. There's one that's really popular right now that I'm seeing. It's the Plated Prisoner series. It's Gleam and Gild and Glint and Gold, whatever. Okay. The first book, loved it. Second book, meh. Third book, I gave it a 1 star and I said, Time of Death, October 11th, DNF. Talk about a letdown. First book was great. Second book was okay. Third book was me staring at the Kindle, disassociating to recover from the missing plot. Maybe I'll develop Alzheimer's in the future and give this a shot again. Dang. I also have a really great one for Court of the Vampire Queen by Katie Robert. Gave it a 1 star and a DNF, and I said there's no plot. Just a lot of tits, dicks, and ass. We were talking page 4 or 5 it starts. Much like how men are, there was no foreplay involved. Just jumped straight into it without warming me up properly. And then I'll just share one more with you. There's a Haunting Adeline and Hunting Adeline. Okay. It is a dark romance. And people tell you got to check the trigger warning. Trigger warnings are actually just menus. Okay. So don't listen to them. I did give it, was that 3 stars? And I said, I need to swallow a Clorox wipe and bathe in holy water after reading this. So if you're on Goodreads, you can totally add me. If you want book recommendations, I can give them to you. But if you tell me you don't like my recommendations, I will unfriend you because I can't take the heat, especially mainly if it's just series that I really love, like A Court of Thorns and Roses, Sarah J. Maas. Okay. Love her. The Empyrean series, Rebecca Yarros, love it. So if you've got some beef with like series that I really truly enjoy, I don't want to hear it. Okay, now that nonsense is over, let's do drugs. All right, my resources for today's episodes are DEA, European Journal of Anesthesiology, Intech Open, PubMed, Harvard Health, WebMD, Michigan Medicine from University of Michigan, clinicaltrials.gov, the University of North Texas Health Science Center at Fort Worth, CNN, and rehabs.uk. So ketamine is a dissociative anesthetic that might have some hallucinogenic effects. It can leave you feeling not in super control of your body, distort your visual field and your hearing. It can induce a state of relaxation, immobility, pain relief, and maybe even a little bit of amnesia. But on the bright side, it's not very long acting. It is an NMDA receptor antagonist. It blocks the N-methyl-D aspartate neurotransmitter in the brain. That took me about 6 times to say that correctly. With an onset time of about 30 seconds, half-life is at 10 minutes. You can see the short duration of action after the initial bolus or the push of medication. The effects of this drug typically wear off in 10 to 15 minutes. So a nice way of putting that is you get a nice relaxation sedation medication where you can protect your own airway, relieve pain, and it's short acting, so you don't have to worry about like monitoring for too long after you get the medication because it'll metabolize. In the 1950s, a laboratory named Park Davis and Company, if that doesn't sound familiar, it's now known as Pfizer. It's located in Detroit, Michigan, and they were researching for an ideal anesthetic agent with pain relief properties. Maddox was a chemist, and he discovered a process in 1956 that led him to creating a compound. That compound was sent to Dr. Chen, who was a pharmacologist, and he studied with Dr. Domino, and they started experimenting with this drug in animals. And it came off as a very potent painkiller in animals, and they were doing laparotomies on monkeys, and they appeared to not be in pain, but the monkeys were basically checked out, and like they were laying there eyes wide open and stiff. So Calvin Lee Stevens, he was a chemical consultant to Park Davis. He saw this, he took a unique series of the compound, did his little nerd magic, and he found that this byproduct from one of the agents produced excellent anesthesia, and it was short acting. It was selected for human trials, and it was actually named ketamine since it was a ketone together with an amine. In 1965, the group that was working on this drug said that it was an anesthetic, pain reliever, and a cataleptic or seizure-like, but it lacked the hypnotic properties. Park Davis Labs contacted Dr. Domino to study ketamine in people, and since he wasn't an anesthesiologist, he called up his buddy or telegrammed him, I don't know, old people, Dr. Corson, and said, "My brother in Christ, I know you have an interest in IV anesthetic. Come check this shit out." So the first human administration was done August 3rd, 1964, with volunteer prisoners from the Jackson prison in Michigan. There were adverse effects with it, though. They were looking at like a 1-to-3 ratio of people that actually had not great reactions. The first clinical study was published in 1965, and to help make this medication sound better, because the word that they were thinking of was schizophrenomimetic, and that doesn't sound great. They were like, well, maybe we should use dreaming. And it's kind of funny, right? Because Dr. Domino's talking to his wife about the trials, the studies, what these patients are reporting of feeling. And she mentioned, she's like, sounds like they were feeling kind of disconnected. And so maybe call it a dissociative anesthetic. And would you believe it? The woman was right. Ketamine was characterized as a dissociative anesthetic. So shout out to Tony Domino, pop off queen. Research continued on ketamine, and it was published in articles all over the world. It was proving to be a great anesthetic, but it was less potent, and it had a shorter duration than the original founded compound, as they had called it, literally PCP, mainly because of the psychic problematic effects. When ketamine was introduced in Britain in late 1969, it had been described as a disaster from which the drug would never recover. In 1970, hallucinations were considered to be so unpleasant that patient acceptance was much lower than with barbiturates. But Belgium said, screw you guys, this is some good stuff. Belgium patented ketamine as a vet anesthetic in 1963, while Parke-Davis patented it for human use and animal use in 1966. It hit the market available for prescription in 1969 in the form of ketamine hydrochloride, brand name Ketalar. It got the official stamp of approval in 1970 by the FDA for human consumption and is actually used in Vietnam War battlefields as an anesthetic. The pain relief properties were a major argument for its development. In response, chlorpromazine, diazepam, or droperidol were proposed to limit the emergence excitement, which was still an issue when ketamine was used for induction, like when you're going to sleep for surgery. Just fancy words for, when you get ketamine for sleepy time for surgery, you can wake up like disoriented, thrashing around. So if you were given those 3 medications, chlorpromazine, diazepam, or droperidol, it can help limit you getting a little bit buck wild back and pack you. But in 1971, it was found if you give smaller doses, you get moderate side effects. So enter the scene propofol, the Michael Jackson drug, milk of amnesia, the forbidden milk of choice, whatever you want to call it. Propofol drove down the use of ketamine alongside the abuse that was starting to kind of pop up during the Vietnam War and on the East Coast. This abuse increased from 1978 onwards thanks to a few books that were published. Journeys into the Bright World and The Scientist. They were authors that told their stories with psychedelics, and so ketamine in 1999 was placed on a Class 3 controlled substance list. Dr. Jansen, though, an English psychiatrist, found ketamine that was used in palliative medicine under medical supervision could actually be used to treat mental distress. Jansen, my brother, you were onto something, but it's going to give us about 20 years to figure that out. So, obviously, we still use it, right? We still use it to this day in anesthesia, but not everybody gets it. When I had surgery, I really wanted to try it because I'm thinking like, hey, this is going to be my only chance. But alas, I was denied. So my sweet, sweet ketamine and I never got to mingle. I also just don't want to pay thousands for ketamine clinic treatment. So I figured, hey, let's just give me some. Let's see if it fixes this depression. Instead, I went to sleep yelling about it into my oxygen mask. And then I woke up in PACU. So we utilize ketamine in a few different ways in the hospital setting. Low-dose ketamine is considered a sub-dissociative, and it's safe, efficient, and effective pain relief that is used for trauma patients, and you can do both pediatric and adults as either an alternative or in combination with opioids with minimal impact to your hemodynamic stability. Fancy words for it's not going to kill you or make you worse. Studies also show that patients who have sub-dissociative infusions require less pain medication and just overall had better hemodynamic stability. I've used it only in infusion settings for trauma patients, and I can't tell if it mixes well with straight drugs or not. I'll let you be the judge. I did have someone once that did a bunch of meth and wrecked a vehicle, came in as a trauma, and they got a ketamine infusion. They would not stop touching themselves. Okay, you know those posy boxing mitts? Came right off. Try to reason with them? Absolutely not. Called their parent? Nothing happened. Okay, try to reason with them? Not today. We couldn't get an order for restraints because the doc said, well, they're not hurting anyone. And I'm like, well, they're hurting all of our eyesights because we see it. And then there's a sitter in there, and so it's hurting their eyesight as well. It basically just got to the point we had to drop lube on the area because it was not happy about the sudden increase of attention it was getting. But when the drip was discontinued, that whole business stopped. So, I mean, you could say, doesn't sound like a bad mix to me, or you can say what I did. I need to bleach my eyeballs. That was disgusting. So, it can also be used for acute agitation and excited delirium. You also can use it for procedural sedation. I've used it in the ED as like a small IV push. So, you've got confused Mima that's out here throwing hands. You need to get an NG tube in her. K-hole, okay? Wears off relatively fast, so we don't have to worry about oversedation or needing to hold on to that patient, longer than what we need to because we need to monitor them before sending them off to the floor. There's even a fun mix. It's called ketofol, which is a mixture of propofol and ketamine, or as I call it, my dream team. So using it in the ED, ketamine mitigates the propofol-induced hypotension, Propofol mitigates the ketamine-induced vomiting and emergence excitement. It can be used in adults and pediatrics. Ketamine and Versed are also used for orthopedic interventions. So if you got to pop like someone's hip or shoulder back into place, try and reduce a fracture, you're getting my second dream team. It doesn't have a name, so I'm going to call it Ketased. So with Ketased, you will have a lower risk for hypoxia, low oxygenation, and reduced pain. Ketamine mixed with a little tiny baby dose of Dilaudid 2 shows rapid and profound pain relief without significant side effects. There were concerns at first with the use of ketamine in traumatic brain injury patients due to the fears of increased intracranial pressure, but studies have shown that ketamine can actually be helpful with combative trauma patients who need airway management, pain control, or anesthesia induction on hemodynamically unstable trauma patients. Intracranial pressure doesn't increase with ketamine, and this is important because high intracranial pressure can lead to brain or spinal cord injuries, seizures, stroke, neurological damage, and death. It also does raise blood pressure, improving cardiovascular stability, unlike most sedating drugs. It's also a considerable option when you're treating trauma patients in shock. In the OR, we use ketamine on induction with some patients. It has a bronchial dilatory profile, which is a widening of the airways in your lungs. So it can make the induction and maintenance easier and safer for patients with asthma or with life-threatening bronchial constrictions. Like I mentioned, it is also good for unstable patients as it has favorable cardiovascular characteristics. It stimulates the central nervous sympathetic system, and it inhibits neuronal catecholamine uptake. High levels of catecholamines can cause that fight or flight response, so like fast heart rate, high blood pressure, sweating, anxiety, and headaches. And your central nervous system is responsible for motor control, sensory cognition. So with stimulating your CNS, you're increasing activity in the brain and spinal cord, heightened awareness, attention, energy. That way, when you are coming in, you're in shock, you're kind of starting to shut down, and you want to go to sleep, hit you with some ketamine. You're not waking up to meet Jesus. You're waking up to me hovering over you. Ketamine is also one of the very few drugs approved for an anesthesia induction in C-sections. It would be considered the drug of choice in children and burn victims. If you're having open heart surgery and you're getting like a coronary artery bypass or a valve replacement or any surgery on the heart, you're placed onto something called a cardiopulmonary bypass. Think of it as like an external heart and lung machine that is oxygenating your blood and pumping it while your heart's essentially turned off. There are new studies that are coming to light too that might suggest ketamine during induction for patients undergoing these procedures may decrease postoperative delirium. If you haven't ever experienced someone going through that, delirium in the hospital in general, and don't get me wrong, one day I'd really like to do an episode on this, but like delirium in the hospital is awful. And like we would see it a lot in open heart patients. And so it really sets back their healing process. But like I said, I want to cover delirium and all that good stuff in a future episode. So I'll try not to spoil it now. So 9 times out of 10, if you have surgery, you're going to be sent home with pain meds, but you can have patients who are more sensitive to pain that require more pain meds. Ketamine can actually block those mechanisms for the sensitivity when administered at sub-anesthetic level and repeated doses. It showed prevention of the development of increased pain sensitivity and opioid tolerance. So if you have a patient with a history of opioid abuse, you can give them a preemptive bolus for opioid sparing effects. And it's always a risk for these patients that have surgery because, they're going to get pain meds. They're going to get back essentially onto something that they were addicted to. So, you can't have surgery without it. So they're at a higher level of relapsing. And so ketamine can help you give less pain meds. Using ketamine for post-op pain, sub-anesthetic doses are effective at reducing morphine requirements in the first 24 hours, as well as reducing post-op nausea and vomiting. And when I say sub-anesthetic, I'm meaning like lower doses than would be required for anesthesia. I don't know if I mentioned that. So after a cholecystectomy or gallbladder removal, if you give ketamine in the sub-Q tissue, so in that fatty tissue, it provided better pain control for 24 hours. There is a Dr. Feltraco and his colleagues, and they found that an epidural infusion of sub-anesthetic doses of ketamine during thoracic surgery provided better post-op pain control than an epidural of ropivacaine, which is kind of crazy because like whenever I would get minimally invasive mitral valve replacement patients, I swear they struggled with pain more than open heart patients, which is crazy, right? Because minimally invasive, they would just go through the right side of your ribs to do surgery on your heart, versus open heart, they'd take a saw, run it down your sternum and like crack that bad boy open. And so minimally invasive, they would get these on-cue pumps, which are like little round balls, and they infuse local anesthetic over like X amount of days, and they would still struggle with pain. So maybe, hear me out, they should study if they switched that to ketamine, or maybe just did like a little like half and half dose. Maybe that'll be my retirement plan. Don't take it from me. It's also great in pediatric use. You put ketamine around and like in surgical site tissue if they're having surgery, and it provides them with great pain relief without major side effects. It's considered superior to bupivacaine in terms of requiring more pain meds for relief, so it can promote restful sleep patterns and the early resumption of feeding. For tonsillectomy kiddos who are having post-op pain, you could apply a topical tramadol and ketamine mix. For pediatric burn victims, there was a prospective randomized double-blind study that had patients from 1 to 5 years old with burn areas up to 10% of total body surface that required bedside wound care, and it showed that the combo of ketamine Versed, was better for pain control than the combo of Versed, Tylenol, and codeine. So outside the hospital, we are seeing these ketamine clinics pop up. In 2019, the FDA approved a nasal spray of a medication called esketamine, or Spravato. And that's just another version of ketamine. It is for like hard to treat depression or refractory depression. The guidelines, though, were that you are required to be under the supervision of a healthcare provider in a certified doctor's office or clinic. I did show meaningful decreases in depression for short-term treatment versus the placebo group, and I will add that both the groups continued taking their antidepressants. A long-term study showed that esketamine helped people stay in a stable remission of their depression 16 weeks into treatment. If you haven't ever taken antidepressants, it's literally take this pill and you will maybe feel its effects in a month or so. If not, maybe we'll change it, maybe we won't. And I'll tell you this, the side effects suck, okay? I'll do a whole episode about depression, medications, all that kind of stuff, right? I've been on several. Paxil was probably the worst. I almost felt manic getting on it, and I would dry heave for hours after taking it for the first 2 weeks. Effexor might be TMI, but I think if we're in healthcare, there's no such thing. You can't get off, okay? You can't feel your clit. You can't get off. You don't want to have sex. And I've heard that from a lot of people who have taken it too. Fluoxetine, not too bad, okay? You could have told me that my apartment had caught on fire and burned everything to the ground, and I probably would have just shrugged and been like, it is what it is. With ketamine, though, the relief from depression happens pretty rapidly. You can start feeling the benefits within about 40 minutes. Typically, when you're starting esketamine treatment, if you go via the nasal route, you're getting it twice a week for 1 to 4 weeks. And then you go for once a week for 5 to 9 weeks. Then once every week or two after that. It can change depending on your treatment plan, but this is kind of a general one that I found on the internet machine. Alternatively, you can do like an IM, intramuscular, so like your shoulder, your thigh, your butt, or an IV route, but those have not been approved by the FDA, so insurance wouldn't cover any of it. Most research does look at IV ketamine because you can guarantee how much that patient is getting, versus like there's arguments with the nasal route that like, well, maybe you sneeze after and you lose some of the medication, maybe it leaks out, maybe you don't get the full dose, so they could be variable. There is a difference in doses, numbers of treatments, and length of time between treatments when you're treating other conditions like anxiety, pain, PTSD, or bipolar disorder, but the general idea is the same. Krista Coulter-Scott started her treatment in a clinic in Gainesville, Georgia in 2021, where she was supervised by a nurse practitioner. Krista had suffered from depression and anxiety since childhood and was diagnosed with PTSD and chronic pain as an adult. She stated, "Before ketamine, I felt anxiety, PTSD, and depression had ruled my life. I couldn't enjoy anything." She had tried multiple antidepressants, and ketamine helped her depression and PTSD, but not the anxiety. When she was undergoing her treatment sessions, Krista felt like she was on a spiritual journey. She felt warm, safe, and confident. All the weight was taken off her in layers. She felt like she had the power of the universe at her fingertips. That to me sounds wonderful. Okay. It's also important to add in that after the treatment, the individuals should be encouraged to talk about their experience, either with a therapist somewhere or their provider. That is highly recommended by a large majority of providers that give ketamine treatment. So, how does this work in the brain? Individuals with long-term or severe depression can lose important connections in their brain called synapses. Those let nerve cells communicate. The belief is that the number of synapses go down because of the severe stress triggers reactions in the brain that eliminate those synaptic connections. With the first dose of ketamine, those lost connections regrow within 24 hours. The researchers that were looking at this actually used a PET brain scan to observe. And so they were seeing that the more synapses that the patient was growing, the better the antidepressant effects of ketamine that the patients were having. Some nerve cells in the brain involved in mood use a chemical called glutamate to communicate with each other. The nerve cells need glutamate receptors in order to join in on the communication. Individuals who have depression, those nerve cells aren't as reactive to glutamate anymore. They get so worn out or weak that they can't really grab onto it. So with ketamine, those nerve cell connections are restocked with new glutamate receptors. So that way the ketamine helps create new nets for the receptors so that they can go back to catching glutamate and the nerve cells can start responding to it again. So with regrowing and reactivating synapses, it helps the brain's ability to change, which may help it shift out of that depression state. This also might help explain why antidepressants or psychotherapy that didn't help before might start helping after the start of ketamine therapy. The clinical study BioK had 74 individuals that went through ketamine infusions for depression treatment. They were studied across at least 4 different clinics in Michigan, Maryland, and Minnesota. And just after 3 infusions over 11 days, 52 participants saw their severe depression ease so much that they had achieved remission. Another 15% responded somewhat. Half of those who had thought often of suicide before receiving the treatment experienced a dramatic drop in those impulses as well. Downside, though, was about 1/3 of those individuals didn't respond to any of the infusions, and that is what the BioK team hopes to learn by studying molecules in blood samples from the participants and nail down biomarkers that could predict who is most likely to get relief from ketamine and who should try other options. And that would be important considering a majority of these ketamine treatment centers are private pay. Esketamine, the nasal spray, is FDA approved, so insurance can be worked in to help cover the cost. But as far as IM and IV, that, my friends, is self-pay. That is because it's still considered an off-label use to be used for mental health, so insurance says, hell no. From what I can tell in my area, you can buy packages, and I'm sure that's very common at a lot of these, and they're going to vary by cost and like how many. So one of the ketamine clinics in my area for depression treatment, 1 infusion is $500. 3 infusions are $1,350, $1,350, and 6 of them are $2,400, $2,400. Booster infusions are $350 per booster if you are considered an established patient. For pain treatments, they are about $800 for 1, $4,500 for 6 of them, and $7,000 for 10. And I will note that the pain infusions are 4 hours long, while the depression or mood disorder treatments are about an hour. For fibromyalgia treatment, 1 treatment will be $650. 6 treatments will be $4,050, and 10 treatments will be $6,000. And I appreciate a place that puts these rates up because I hate when they want you to call. I always feel like I'm going to call. I'm going to get caught off guard with the price. And I'm going to be like, oh my God, and then I'm going to be uncomfortable and I can't get off the phone. Okay. That's why I make my fiance call people. He loves that shit. He's never met a stranger. There's another facility near me that does compound troches, and they are like wax-based lozenges that you put in your mouth. Apparently, it is more cost effective compared to IV infusions. Their website also states that they complete all treatments in clinic to observe patients for safe and effective treatment. But if your provider determines you are an appropriate candidate, you may be allowed to continue treatment at home. That to me sounds great. Snuggle my dog, put on some headphones, nice relaxing music, go down a little K-hole. All right. Might be reaching out to them to see about the cost. And if I end up, pursuing that, you guys will be the first to know. Maybe I'll record an episode while I'm on my K-hole and let you guys know how it's going. Of course, anytime there is a good drug out there, it's going to be abused by individuals. You can always count on the human race, am I right? Abuse and misuse of the medication are part of the black box warning on esketamine, hence the monitoring under professional standard. Ketamine bladder is something that can occur if you use too much chronically. There are like lesions on the lining of your bladder and they like have to pee frequently. And apparently that is a typical telltale sign of abuse. And it is rare, but 2 to 4% of ketamine users may develop a type of psychosis that looks like schizophrenia, and it does not respond to medications. Symptoms typically wear off in like a few weeks or a month, but with chronic and heavy use of ketamine, it can last up for months to years. If you take benzos, like benzodiazepines, those can dampen the effects of ketamine due to the glutamate release. So it is recommended to skip those medications on treatment days, but people with bipolar disorder shouldn't, because in rare cases, ketamine can trigger a manic episode. But we're talking about abuse and street use. So on the streets, a special K trip has been known to be better than LSD or PCP, thanks to the hallucinations and the short duration, right? There's different slang for how you might be feeling during your experience. There's K-land, which is a nice, mellow, and colorful experience. K-hole, which refers to out of the body, or you feel like you can have a near-death experience. Baby food, which is the user sinks into a blissful, infantile inertia. And then there's God, right? The user is convinced that they have met their maker. Would not like that one. Dr. Andrew Yockey wrote for the Journal of Psychoactive Drugs. He was looking at the use of ketamine. So starting somewhere in the 1980s, they started seeing ketamine start working its way into nightclubs. There was a bit of a decline, and now we're seeing it rise back up. Clubs, festivals, raves, they're very popular places to take the drug. And who can blame them? Have you ever been to a rave? First of all, the amount of drugs that flow through that place, okay? But also you got the lights, the colors, the animations that different artists put on their set. I'm sure it's one hell of an experience. Yockey looked at his demographic and self-reported of previous year ketamine use among almost 210,400 adults over the age of 18. So he found in that survey, males were more likely than females to use. There was no significant differences with race or income status. Males between the age of 26 and 34 were shown to be at an increased risk compared to those 18 to 25. And men reporting themselves as having college education were nearly 2.5 times more likely to use ketamine. Gay men were more likely to report use over the previous year. Prior drug use among all the groups was significantly associated with the use of ketamine, with the highest odds among men who had used LSD in the previous year. For women, those reporting past year use of cocaine were nearly 30 times more likely to report that they were also using ketamine. Street names for these drugs are K, Special K, Cat Valium, and Vitamin K. At least those are the most common ones. Ketamine's also often mixed with other drugs, so like powder and tablet form. To mix it with MDMA, it's a pretty popular combo. It's also commonly found mixed with amphetamines, methamphetamines, cocaine, and carisoprodol. Not confident what that is. In a 2022 national survey on drug use and health, they reported that among people aged 12 and older in the U.S., 762,000 used ketamine in 2022. I'm sorry, 12 years old? Where are your parents? How the hell are you getting your hands on ketamine? How do you know what it is? Why are you doing it when you're 12 years old? I think I'm pretty confident when I was 12, I wasn't even sure what the other meaning of pussy was besides a cat. And that was me at 12. All right. Matthew Perry. He's an actor from the series of Friends. He died in October 2023. He was found unresponsive in a hot tub at his house in LA. He was pronounced dead. 5 people were arrested in connection with his death, as the main culprit of Matthew's passing was ketamine. People close to him told the coroner that he was undergoing ketamine infusion therapy. The medical examiner said he was being treated by both a psychiatrist and an anesthesiologist, and his last ketamine therapy treatment was a week and a half before his death. Matthew was procuring ketamine outside of his infusions, allegedly from a drug dealer, and that dealer had distributed the ketamine to him that was essentially going to end up killing him. So there was the Dr. Salvador Plasencia and Mark Chavez, Eric Fleming, who was a friend of Matthew, Jesvine Sanga, the alleged dealer, and Matthew's assistant Kenneth, who was actually the one that was like also injecting him. He has 0 medical training. Jesvine has the nickname the Ketamine Queen, as she basically ran a drug selling emporium in her home. Quite the nickname if you ask me. So ketamine is being blamed for his death as far as like a ketamine overdose. His assistant, Kenneth Iwamasa, it was actually like injecting him multiple times a day, like per Matthew's request. And unfortunately, we would know, hey, you only need to like get injected maybe like once a day. And he was doing it 2, 3, 4 times a day. The UK has also dealt with issues revolving around ketamine and abuse as well. In 2021, 1.3% of the age group 16 to 24 reported using ketamine in the past year. The end of March 2022, the UK saw a record amount of ketamine seized by the police, as the quantity of the confiscated drug rose by 884%, from 208 kilograms to 1,837 kilograms. In 2023, out of 4,000 requests for treatment in a rehab center, 15% of that was for ketamine, and in 2024, they saw that double to 30%. So, I mean, not a great way to end this, right? But I think ketamine does have a lot of potential. I think it's showing a lot of promise in its research to be beneficial in all different aspects of healthcare. Unfortunately, you are going to have people that are going to abuse this because, people are going to people, unfortunately. And it is important to talk about the addiction because it's kind of feels like if it's something that we don't, are we just ignoring that it's a problem so we can focus on the good? So something kind of similar to that, right? Where are we going to ignore the bad things in lieu of the good things? Next week, we're going to talk about J. Marion Sims. He is a 19th century gynecologist, considered to be the father of gynecology, and he was held in high honor for his contributions to medicine. The dark side. He would perform his procedures and experiments on enslaved women of color. So, catch us next Tuesday as we dive into that dark part of our medical history with a dash of crime. We'll just call it Crime Bag Tuesday, if you will. So until then, I will catch you guys on my socials at Under the Scrubs Podcast on Instagram and Under the Scrubs on TikTok. I will see you guys next Tuesday. Okay, love you. Bye.